for migraine and headaches that patients come in with here at my office. So we normally kind of categorize our headache patients into different scenarios. The first one is tension headaches. So very common, usually a tight band around the head. Tension headaches will sometimes pop up from the back of the neck area here. You'll see a bunch of the muscle structures itself that attach to the base of the skull, and there's usually 3 layers that are associated with it. So I'll try to do some muscle testing, maybe an ultrasound as well, to kind of isolate and see which muscles may be involved. And depending on the patient itself, you can actually see that some dry needling itself may kind of help alleviate some of that pressure around that area. The second one is your traditional migraine headache, where lights bother it, you get that aura sensation, you get the nausea. These type of migraines itself can be associated with a variability of different things, such as a chemical imbalance, hormone imbalance. We usually will look for food allergies, any type of other toxicity itself. And you really want to avoid flashing lights. You get that blurry vision, sometimes even vertigo and things. So I'll try to evaluate where that migraine is technically coming from, and depending on whether we need to do like a ozonated Myers cocktail, which is a vitamin blend of some magnesium and other natural vitamins that help kind of calm that migraine down. What we found with migraines itself is that patients that have been on medications long term, your body kind of gets used to those medications and then it just doesn't work. And most of my patients are not wanting to just keep taking those medications because they know the damage it does to your systems in the long run. So the second one is going to be your sinus headaches itself. So you have a lot of musculature here, and sinuses, you have 4 different areas. So you have the sinuses underneath your eye, and you actually have the sinuses right above your eyeballs itself. And so we'll kind of isolate and kind of see which sinuses are involved. And you'll kind of see up in this area here that these muscle structures around the orbit and this nasal structure itself can actually cause a lot of that tension. So we want to rule out any type of infections or any other type of damage. A lot of those patients can also benefit from some of the treatments I'm going to be discussing here in a little bit that is in common with some of the tension headaches as well. The other type of headache that is the most common that we see is TMJ type of headaches. So if they've already gone through evaluations with their dental office and ruled out any type of wisdom teeth, things like that, what we'll do is we'll kind of evaluate things like the masseter, the sternocleidomastoid. I'll look for some of the pterygoid muscles inside the jaw itself, and we want to make sure that that itself is not contributing to some of the TMJs where the jaw is kind of moving out of place a little bit and causing a lot of inflammation around that area. One of the other really common things that we see with our patients that come in with headaches are patients that may have been affected from whiplash itself. And so whiplash is pretty common, and that is where they either have cervical instability or damage to the ligaments itself. And a lot of the muscles that are going to be in this back part of the neck here will actually have some minor tears and strains and sprains, especially around the occipital area itself and back into the trap. Those type of patients, it is impertinent that if you're in a car accident, that you get treated at least within 48 to 72 hours, because your body does start that healing process and you don't want a lot of scar tissue and long-term headaches from that area. Frequently asked questions are for headaches. How does chiropractic help, and what are some of the other treatments that I utilize? So I'd utilize specific chiropractic techniques for that because it is not a matter of just doing a lot of treatments. It is something to basically kind of stabilize itself by just performing necessary adjustments, getting the alignment and getting that pressure off, allowing blood flow to actually go through. So I usually utilize a digital motion x-ray, ultrasound, a good exam, and look for any type of weaknesses and perform the adjustment on that. Other treatments I utilize is dry needling techniques to help kind of clear out any type of inflammation or trigger points. The other type of treatments we utilize is going to be any type of prolotherapy, which is a ligament and tendon repair. I'll do neural therapy, which is a natural way to calm the nerve down itself by injecting specific spots. We'll do ozone IV infusions, Myers cocktails, and a various other amount of detoxing for inflammatory conditions that may actually be contributing as well. So there's so many other treatment options that are out there. You can visit us on the web at venturasclinic.com. You can actually see a lot of the blogs and a lot of these videos that I actually utilize to kind of explain to you and show you how some of these treatments will look. The majority of them are very gentle and very, very successful. A lot of times my migraine patients can see a result in as little as 1 day. So if you want to sit down and evaluate to see if these treatments can be beneficial for you for your migraines, give me a call at 405-848-7246.